name is Erin Montgomery, and today I'm going to show you how to insert a Foley catheter. The first thing that I would do is I would confirm the order, and then I would knock on the patient's door. I would identify myself as the nurse. I would explain the procedure, perform hand hygiene, and provide the patient with privacy. Then I would make sure to check the bracelet on the patient hospital bracelet, and I would use two patient identifiers to identify the patient and check their allergies with them, specifically iodine and latex. Then I would use my general principles and safety practices and raise up the bed to an appropriate working level above my waist. Now I would wipe down my workspace with a wipe, make sure it was clean. And then if the patient did not have a chuck on, I would put on my gloves and insert the chuck. I would put on a bath sheet and remove the top sheet, and then just cover them with the bath sheet. Then I would remove my gloves and perform hand hygiene. Now I'm going to remove this. So now I'm going to perform pericare. Unfortunately, my kit did not come with the wipes to use for pericare at the beginning. So I'm just going to vocalize how I would do it. So first thing I would do is I would ask the patient if they have any ailments that would prevent them from lifting their legs up and bending them a little bit. And then I would open up my pack of wipes. I would spread the labia. I'd get one wipe, go on the outside, dispose. Get my other wipe, go on the outside, on the other side, and dispose. Get my last wipe and go down the middle, dispose. Then I would put their legs back down, cover them back up, and then dispose of my gloves. And then hand hygiene. Now I'm going to open this. Using the 1-inch border. Then I'm going to get my gloves. Again, using the 1-inch border to make sure not to contaminate the gloves. And then left hand first, making sure never to touch the package or the gloves to anything. Then I would dispose of this. Is that it? That's it. Okay. Laying that down. And then after that, I would move this to that. So first thing that I would do is I would wet my wipies, or my sanitizing sticks for pericare with the Benadine. Then I would get my saline and I would connect it to the catheter and sit that there. Then I would get my lubricant I would open this, pour it in, then dispose of that. Then I would get the end of my catheter and make sure to put the end at least 2 inches in to the lubricant. Now that that is done, I am going to get my pericure done. So the first thing that I would do is I would open the labia using 1 stick at a time. I would go to the outside, making sure not to go back up, dispose. Go on the other side, dispose. And then going down the middle, dispose. And then I am going to get my catheter and then twist it into the urethra. No, that is in. This is no longer sterile. So I can move this. Now I am going to inflate my balloon. If I felt any resistance going in, then I would twist a little bit, and then if I feel any resistance while I'm inflating the balloon, then I would stop and reposition. And before I inflated the balloon or inserted my catheter, I informed the patient to take a deep breath in to help with the pain or the uncomfort. So now that that is done, I'm going to take off my gloves. Dispose, hand hygiene. And now I am going to show you how I would put on this. So I did hand hygiene after I took off the sterile gloves. So I open the package. And I don't have a leg to show you how I would attach it, so I'm just going to say that this is my leg. So before I got this out, I would have cleaned the area with an alcohol wipe. And then once that was clean, I would attach this to the V, under the V, just like that. And then I would separate this, remove the adhesive tape, and then place it on this part of the thigh. So then I would attach that, and then once that was done, I would hang my cath bag, and I inspect my tubing, make sure there's no kinks or anything. I would hang it on the bed frame, not the railing. So now that was done, I would start disposing of everything. So just start making sure everything's clean. I would remove my gloves, and I would perform hand hygiene. Make sure to clean up the patient's bed, make sure that they're positioned in a comfortable manner. And I would record and report, hand hygiene, come back in a little bit, make sure that they're doing all right, there's no pain or anything like that. And if there was a urine specimen that needed to be taken at a certain time, I would come back and take that. And that's it.